All right, so now it is my pleasure to introduce our newest executive director, our newest leader, Dr. Krystal Redman. So Marge just spoke to some of Krystal's qualifications, and it was her experience in grassroots organizing, her health justice, social justice, reproductive justice that really brought her to our attention in the search. Her expertise and leadership in health promotion and disease prevention initiatives and organizing toward equitable access, care, and treatment within community-based and centered programs, all aligned with BC Action's mission. In addition, her personal focus on working on to expand resources, information, health education, and access to equitable care and coverage for young people, women, and families convinced us that she could step into the BC Action Executive Director role. And with that, I will let her share more about herself and her goals based on her first month here, but we're lining them up for her. And on behalf of the Board of Directors and all of our supporters here today, I am pleased to introduce Breast Cancer Action's Executive Director, Dr. Krystal Redman.
Thank you so much. Thank you so very much. Wow. First, I have to follow Karuna and Marge, which is already stressful in itself. Two amazing leaders. I just amazing individuals too as well. So one, thank you for the beautiful introduction to Peggy, to Karuna, to Marge. It's just very warm. And I'm just really excited about this incredible work at BC Action. I'll tell you, when I first came across BC Action, what like hook, line, and sunk me was Karuna's anti-racist statement on the first page of BC Action. And I'm sure everyone has went to our website. So we have this slider screen and the messages continue to slide, and I seen this anti-racist letter. And as soon as I read it, it disappeared. So I'm like searching the website, like I need to find this statement because one, I've never seen a breast cancer activist organization make an outward statement like that, especially in a moment where folks think it's like, cute or commercial to make a statement, but not have intention around the work and the steps that need to be centered in order to truly become anti-racist in everything that they do. I just remember reading that letter and said, wow, and then starting to like unveil other things, going into their strategic plan and from 2014 and seeing it named in the strategic plan and what they envision and how they see this rolling out in everything they do. And it was so powerful. So, so thank you to Karuna, and thank you to the legacy of Barbara and her work. And thank you, Marge. I know that Peggy has said some amazing things about like the work that Marge has brought. And I would just say from day one, having a blueprint for what are our next steps in onboarding, having that support, being able to just have one-on-ones with someone that has history with the organization on different levels of support, as well as like history and movement, history of working within like non-for-profit space, as well as, my friend, a DRPH, our public health friend. So, having all these different lenses was very important in the onboarding of myself and as well as with our team and our staff and our board. It was just a spectacular experience. So thank you. And I would like to thank everyone here for giving us your time and allowing us to just say thank you to you and giving us space to just introduce myself and the organization and what we plan to do moving forward. And another thank you, if I haven't said it very clearly before, our staff, our team at BC Action is amazing. You would never know that our team is small, but like super mighty, just having 6 folks on the team, navigating all of the work, all of the partnerships, the fundraising, the beautiful things that BC Action does. You would be amazed by everything we do. So thank you so much for the team and for the board and everyone that's here. So thank you. Now, so with BC Action, you know that our primary center is really addressing and ending breast cancer through the health justice lens, which is definitely what attracted me to this organization. You see this in our materials, in our processes, in our goals that really are directed towards give an order of addressing the devastating disease. We also know that we must tackle the root causes of health inequities, which are the result of a complex interplay of culture, power, economics, racism, and sexism. And Breast Cancer Action is one of the few organizations that are intentional around centering this interplay and how it directly affects our lives, our ability to not just survive, but to thrive. Here I plan to build on this theory of change and the legacy of our former executive directors to deepen our health justice and equity work and to structure BC Action so that way we have the best, or we can best honor our health justice commitments and fully and boldly live out our values. The overall lap between Breast Cancer Action's legacies and my own goals and visions has the potential to build true power within the breast cancer movement through BC Action's unique health justice approach, which Karuna and Marge uplifted in their talk. We are going to take on healthcare disparities directly through uplifting the most rigorous science and patient-centered data, working towards universal healthcare and driving forward systemic change through the lens of environmental and racial justice. When I say systemic change, I think that especially where the world sits today, that it's very easy to kind of put in these catchphrases, but the way in which BC Action really looks at the ways in which systemic oppression show up within the lives of folks who have been deeply living within the margins historically and currently, they have such intent of the ways in which we're going to tackle, address, and end breast cancer. We're going to take on these health disparities directly. So really centering health justice, and it is more, it's about policy change, but also, as I said, how the histories of profit-driven capitalism, racism, and environmental issues really live within our bodies. This element of embodiment, or rather weathering. So weathering is really the generational long-term trauma, discrimination, and environmental exposures that one experiences and continues to bring with them throughout their lives and the lives of their children and their children and their children. So really looking at how embodiment, how weathering completely is a leading factor in addressing and ending this disease. Our solution must also run as deep, and the solutions to dismantling these systems will not be provided by the systems themselves. So really uplifting beyond the fact that our systems aren't going to rectify themselves, but the folks on the ground, the activists, the folks that are willing to take action will charge these systems to do better, and not even just do better, but what are the ways in which we envision these systems to be designed to truly support our lives, and that we are able to thrive and survive, live healthier and fuller lives. Our challenge and our charge is to center the folks most harmed by by systemic oppressions, to uplift those with the furthest proximity to power and the furthest relationships to power, and to elevate our own stories and our knowledge, as we are the subject matter experts of our lives and our experiences. You know, usually in science field, we call that qualitative data, but on the ground in movement, we call that just stories, lived experience, centering the folks who are subject matter expert in our own lives. My goal is to create a leadership model that brings us to a place where we are actively anti-racist, and not just saying actively anti-racist, but how it truly shows up in everything that we do. Consistently reevaluating how capitalism shows up within our policies, within our practices, within our structures, internally as well as externally, and how we are intentional about our partnerships and what we support. How we are always centering people's experiences and expertise in every step of our work, from how we collect data, to how we analyze this data, to how we share and disseminate our perspectives and our communications so that they are truly accessible. Further, my goal is to continue to focus our resources rather, and ensure that people have access to equitable and rigorous information to support their vital decisions around treatment and care. And I'm intentional around saying their decisions, right? Really centering self-determination, bodily autonomy. Our aim is to provide information, access to information, and also encourage folks to make those decisions. And as you know, BC Action stands to end this epidemic. This is BC Action's time to honor our commitments and live in our values. Your collaboration and involvement is absolutely necessary in how we carry out this work. I truly look forward to working alongside each and every one of you in addressing and ending breast cancer. Again, thank you so much for your support. There are some folks on the call that I've met before that even in my short time at BC Action, I had a chance to have one-on-ones. So my goal is to continue to reach out to our supporters so that you know all about myself if you need to, I get to know you, and we can support each other in this work. So thank you.